to send them to physical therapy. Has nothing to do with what's happening in the operating room. So these are things that I do to help my patients out. I get them as much lordosis as possible, but I send them to aggressive PT for periscapular strengthening. I have these anorexic people that you can tell by having temporal atrophy, like their hair is falling out, like they weigh 117 pounds. And I tell them, you got to eat. And I tell their husband, you take their frickin' scale away. Go ahead.
Just a quick question on your technique to maximize lordosis.
Yeah.
When you said you do a wider decompression, obviously with the bigger, wider footprint.
Yeah.
As far as releasing the PLL.
Right? Yeah, so that's a very good question. First of all, I don't maximize lordosis. I gave them the right lordosis to get their ears on top of their shoulders. So the most important thing for any human being is horizontal gaze. I need to look at you, not your shoes. And we won't talk about the engineers and their shoes. So if you can see this chair here, if my neck is in kyphosis because somebody used parallel cages at the levels above, or there's something else wrong with me, or I have too much thoracic kyphosis. So every patient I have, I check them for scoliosis, make sure their shoulders are balanced. I know what their thoracic kyphosis is. Sometimes you see a patient whose cervical spine is completely straight, and what's happening with them is they have scoliosis, and scoliosis is a three-dimensional problem. There is a curve left to right, which is what you notice, like the lady that was with Pierce Brosnan in the remake of the Thomas Crown Affair, Thor's mother, Renee Russo. So beautiful woman, supermodel, and you read her biography or autobiography. She wore one of those Milwaukee braces in high school from 16 Candles. I don't know the movie you guys see. But I mean, if you want to give a young teenage girl social issues, you put them in a Milwaukee brace, right? So there, she has these all, and when you look at her, she's always, and she's always like standing with some sort of weird pose because her shoulders are still in balance. Who the hell cares? She's Renee Russo, right? She's Thor's mom. So all these people, we look at their coronal balance, but you also look at their sagittal balance. Scoliosis causes hypokyphosis of the thoracic spine. And you think that's a good thing, but it's not. And hypokyphosis of the thoracic spine puts your shoulder blades at a mechanical disadvantage, but also because they don't have a round back in their thoracic spine, their neck lacks adequate lordosis, because if their neck had proper lordosis, they're going around looking at the ceiling now. So when you see a straight cervical spine, when the operating room or on x-rays, the first thing you need is you need to take full-length scolies. And what you routinely find is those patients also have a straight thoracic spine, and they have a little bit of scoliosis, but scoliosis is truly a three-dimensional problem, and a huge part of the problem is hypokyphosis. And you don't operate on the thoracic spine to reintroduce kyphosis unless you're fixing a coronal imbalance. But that's a big thing guys are doing now, is they're trying to restore thoracic kyphosis. And if you give these people who don't need cervical lordosis too much cervical lordosis, they don't do good. These guys with a straight spine actually do really well with disc replacements because their brain can figure out. So everybody that has scoliosis and their neck is off, I really go out of my way to try and do cervical disc replacements on. And just the fact that you notice this and communicate to the surgeon, that's really good.